Hello and welcome to the Confessions of a Random Doctor podcast. My name's Chauvery. I'm a junior doctor who's basically just trying to find her way. Hello and welcome to another episode. I've got the amazing Dr. Laura Owler with us today, who is my good friend from Nottingham, and we're going to be talking about burnout, stress, mental health, and lots of interesting topics. So thank you so much for being here today.
That's all right. Thanks for having me.
So Laura is a great advocate for mental health and well-being in medical students and young doctors, and she's been doing some really interesting work promoting that. She's also done some really interesting research that she presented at the Royal College about well-being in students, so I'm really excited to talk to her about that. I just wanted to start off by asking you, Laura, what made you get interested in being an advocate for mental health?
So I think, honestly, it probably started from quite a young age where I was in a state school in a very middle class community where almost everyone had their own struggles. And I think it was the pressure to achieve. So even when I was 14, we were seeing really severe mental health diagnoses among our peers, and a lot of our parents were of the generation that didn't understand or didn't want to understand or didn't know what to do. So it was quite difficult for all of us, really. And then I think at medical school I started really struggling with my own mental health, probably realistically from first year onwards, but certainly around second and third year, where I just felt like I didn't fit in and I wasn't good enough to be a doctor. And every time I managed to push it down, ignore it, use a variety of coping strategies, some of which were more healthy than others. And actually, honestly, the thing that saved me in third year was cycling and sport. So I started doing track cycling for the university, and it was just incredible to be training every day and just seeing the progression, which admittedly, like, I probably did see with exams. Like every exam up till fourth year I did better because I knew myself better and I knew how to study better. But with cycling it was almost immediate. Like, you saw the numbers each week getting better, you felt better each week. So that kept me through third year. And then at the end of third year, like, I just about scraped the exams by some miracle, honestly. Like, I went out drinking after winning a race 2 days before the knowledge exam, and then I felt guilty when actually I'd passed by about 8% and a lot of people hadn't. We had a 2-week holiday, and I remember that holiday I was dreading coming back, and I told myself if I didn't enjoy pediatrics, which had always been a career idea for me, then I was going to quit and do teach first, because I think secondary teaching was something that scared me when I was at secondary school, because I saw how mean teenagers could be. But then I realized that actually I can relate quite well to young people and I enjoy working with young people. And actually, like, some of my best teachers were my art teacher, my biology teacher, who were just so encouraging and passionate. So I really did start to warm to this idea of teach first. I went to a recruitment event at the university and it was close. And then day one of pediatrics, walked onto the ward and was like, wow, this is why I came to medical school. Like, it's a happy place, everyone's working well as a team. There's kids like with really poor health running around, chatting to each other, creating chaos. There's kids that come in 1 minute with like life-threatening asthma, the next day they're running around. So pediatrics kept me in medicine. And then when I failed, what kept me in medicine was psychiatry. So I came up with the idea that maybe CAMS is for me. And that's still the case now, having had some experience on CAMS during COVID, which was just incredible. Like, almost every resource stripped away, all the juniors stripped away. And it wasn't about getting the kids out as quick as possible to make beds anymore. It was about keeping the kids healthy in a time of real uncertainty and real anxiety, and keeping them sheltered but not too sheltered.
So what did you do in CAMS during COVID, sorry?
So I was on my assistantship placement and I was meant to do 3 weeks in A&E and then 3 weeks in psychiatry and then go off on New Zealand on my elective.
Oh.
So I did the 3 weeks of A&E at Nottingham, like with the dream team there, and I was with an F1 supervisor who was absolutely incredible, and every day things were different, but I loved it because I felt useful, and I learnt so much from the F1s who were just grateful that I was there and that I was interested. And then I switched on to adult psychiatry, and they were a bit behind, so PPE was only brought in on my second week or so, and patients' leave was being cancelled, and it was certainly a difficult time. So I was on adult psych to start with, and I actually really enjoyed that as well, because again the juniors were really deployed, and I was suddenly helpful because I could take blood from people, I could go and talk to patients and get an idea of their mental state, and I felt very supported by the nurses, the F3 doctors, the consultants, who were all just grateful that there was a student who was, one, interested in psych, and two, didn't really want to go home and be locked down with their parents. Sorry if they're listening.
We won't say that. We won't mention that to them.
No. And then basically the consultant was like, oh, are you just here for an easy life, or like, do you want anything signed off? And I was like, no, I'm genuinely interested in psych. And he was like, oh, is there any particular area? And I did 2 CAMs at that point. And he said, you're welcome to just go to the CAMS hospital whenever. I already had a contact at the CAMS hospital who's an eating disorders consultant who's also interested in sports psychiatry.
Wow.
So I met her through the Psyc Start scheme, because we got talking about relative energy deficiency in sport, and I have friends that have struggled both mentally and physically from the sheer pressure of doing sport really exceptionally well as a teenager. And I kind of see it everywhere in sport, but I also see it everywhere in medicine as well, because I think essentially it's all burnout, it's just different manifestations.
You mentioned Psych Start. Could you tell us a little bit about that?
So Psych Start is something a lovely doctor called Tom Hewson set up at Nottingham. Really lovely guy, really passionate about getting people into psychiatry. It was incredible because actually, particularly in my intake of 2014 entry, it was very rare to have anyone openly admit that they were interested in psychiatry.
Really?
There were only a few of us, and everyone was like, oh, is that because you want an easy life? Is that because you want money? And I feel like that's something that's reflected in hospitals as well. And particularly with CAMS, there's this whole thing of, oh, that's really sad, or, oh, why do you want to do that? And it is sad, but equally, I think a lot of medical specialties are quite sad, like gastroenterology and respiratory, where you've got these people that have been addicted to alcohol or smoking their whole lives, and they only realise when it's too late how bad it's been for their bodies. And then you've got these young people that are really, really sick. And CAMS, I feel like there's a lot of hope in it.
Like you said, their ability to bounce back is incredible.
Yeah.
But I just wanted to touch on something that you mentioned, was that you said that not many people in your cohort were able to openly admit that they were interested in psych.
Mm-hmm.
Why do you think that was the case?
I honestly think there's still this massive stigma in medicine about mental health. And when I started to open up about my struggles, people in my cohort were like, oh yeah, like I've struggled too, or oh, like I used to take antidepressants, or I went to therapy last year, or things like that. And suddenly I was like, wow, like, because I very much stigmatized myself. So I failed my fourth year exams, and it triggered the worst episode of anxiety and depression that I'd had in my life so far. So I'd had minor episodes of depression, probably had anxiety since I was about 12, if not younger. But it was always something that I channeled relatively positively. And there was just this feeling of, oh, I can't do everything. And now it's had this massive impact where I'm having to do an extra year of medical school, and I don't know how I'm going to fund it. And it was just this sudden, like, I've no idea what to do with myself, who to turn to. And the first GP I saw was very abrupt. He gave me some propranolol to calm me down for the exam resets. And he was very short with me. It was almost like I was an inconvenience. But then right at the end, he was like, everyone has their struggles in medical training. And when he said that, I was like, so he does get it. He just doesn't have time, and that's sort of okay. And then I talked to one of my friends who's struggled for years and years, and she's incredibly good at the whole self-preservation thing. She knows her warning signs, she knows her triggers, and she knows exactly when to say no. and she recommended a certain doctor, Dr. Gar, she used to work at Cripps. I think she's
Yeah,
leaving
Dr. Helen
now.
Gar.
Yeah, and she's huge on practitioners' well-being and mental well-being, and she was just the most incredible GP I've ever spoken to, and she's certainly someone that I see as a role model. So she helped me a lot, and I recovered quite quickly, and I think that's because I did start SSRI antidepressants, started a relatively low dose, and then it was upped. And what they did for me, and I think this is what they do for everyone, is they give you the motivation to start thinking for yourself and doing things for yourself again. And I think they do it in a positive way if you have something to strive towards. But I think they can also be very detrimental and deadly if someone is feeling very stuck and feeling like they don't know what they want. So for me, I knew what I wanted, and I wanted to pick myself back up and get through the year, and it gave me the scope to do that. And then in final year, when I started to feel depressed and anxious and hopeless again and really fearful of failing again, the antidepressants seemed to make it a lot worse. And then eventually I was on 2, and they were very numbing and slowed my brain down, but they slowed my brain down enough to be able to actually think straight enough to study for finals. So they were quite a good temporary measure then. And I tried therapy while studying for finals, but I didn't have the headspace. So recently I have come off all antidepressants. So I came off the second lot, mirtazapine. I came off them around February because I just said to the GP, look, this weight gain is absolutely horrendous, and I feel like I'm in the place where I don't need them to sleep and I don't need them for my appetite. And then I carried on with the SSRI at quite a high dose because I was like, I don't want to change it now, like got a lot of new beginnings. And then recently, I mean, it's been difficult to get GP appointments, so I did come off them myself, which I would not advise to anyone because any sort of drug has withdrawal effects, and particularly if you're not on a tiny dose. It was horrific, and I didn't sleep for a few days, and I was sweating and shivering. But I'm now in a place where I feel like my brain isn't mush anymore. It's sort of rebuilding itself, and it's reevaluating what I want and allowing me to think about that and take actions. So, like, again, different things work for different people. There are some people who would say I would never come off medication keeps me well, and I think good for them. Like, for me, medication was very temporary, and the best thing for me and my mood and my anxiety is exercise. And it's not just a 10-minute walk, it is variable, it varies from,
Triathlons.
yeah, triathlons, cycling events, like hundreds of miles, but also sometimes 10 minutes in the gym of just some squatting and some core work is all I need. Sometimes I will need a rest day, but a 10-minute walk from work outside is enough. So for me, it's fresh air and exercise. And I think that's why I struggle with long shifts, because I feel very trapped inside a certain space, and I feel like I want to move, but I can't move on my own terms. So sometimes I'll be running up flights of stairs, and sometimes I will be sat in an office at a computer for far too long. So it's difficult. But sometimes I do need a 2-hour run, and that is the only thing that will get me into a place where I can think for myself. And I know that about myself. It's just trying to explain that to anyone.
And how did you come to that realization within yourself that that's something that you needed?
So I started sport properly when I was about year 7 or 8 at school, and essentially what happened is it was the athletics tryouts, and I was the 5th fastest, so I didn't make the relay team. So I joined a club, and I was determined to get on the relay team the next year, and it's just a local athletics club, but we had a really encouraging coach, and there was a lot of really good athletes that I really looked up to, and the training was sort of intense, but it was also, none of it was really mandatory, and I kind of learnt to run. It sounds silly, but actually running is hugely about technique. It's about being efficient, it's about preventing injury, and it's about being strong and powerful. And suddenly the next year, I wasn't the 5th fastest, I was the fastest outright. And girls can be mean, so I remember people used to make comments that I had fat thighs, but actually I knew that my thighs were big and muscular from running, and that as soon as it came to sports day, any girl who'd made that comment would just be quite literally left in the dust. So it helped with my self-esteem as well, and really does always help me with body image, which I think is something that every single girl has struggled with at some point.
Yeah.
And guys as well. It's always been a battle in my head that sports helped with. And I personally would never go to the gym for the target of losing weight or getting better abs. I go to the gym to get stronger and faster.
And I think what you mentioned before as well of that oftentimes in high achieving personalities like you find in medicine,
Yeah.
when people look to sport and things like that to help them with their mental health, sometimes it can also go the other way where
Oh, absolutely. And I've had both.
So I just wanted to ask you a little bit about burnout and what is burnout? How is it different to stress?
Yeah, so a few weeks ago I was struggling, and I think I was on the stress side of things. And the thing I was scared of was the burnout. And I found someone called the Brain Coach on Instagram, who she's a clinical psychologist, and she posted a very simple infographic about stress versus burnout. So I'll just read that out now and kind of explain my own experiences of both.
Mm-hmm.
So stress, she said, the emotional state is overreactive. And I was often very overreactive as a medical student. Like, I didn't take criticism well, and I would either argue with it or take it to heart and beat myself up about it. But also the tiny comments that people make, like, even now I think sometimes I think back at someone said when I was a teenager or in second year, and I'm like, wow, did they really mean that? And they probably don't remember saying it. And I'm sure everyone gets that when they're stressed, and one tiny thing will just send them into overdrive. It might be a housemate being like, oh, can you wash up your pans? It might be dropping your phone in the rain, or not getting your normal seat in the library, or someone talking in the silent section of the library, or spilling your coffee, and suddenly you're like, oh my god, I can't cope.
Yeah.
And then it says here that stress is characterized by over worrying, which is a lot of what I've just said, but it's also you catastrophize. So you might be stressed about one exam because you think you haven't studied enough, and then suddenly you're stressed about all your exams, and then suddenly you're like, can I even be a doctor? Am I going to get through med school? What do I do if I don't? Like, I'm going to let all these people down. I'm letting myself down. And like, you just go into
Like a
overdrive
spiral.
so easily. Yeah. And it says that a chronic form can result in anxiety and related disorders. And I think that's certainly the case in a lot of people where they've been stressed for years because they've been in academia for years. So they've come straight from school into med school, or they've reached setback after setback to even get into med school in the first place. And then they've got this inferiority complex. And it can really manifest in what we think of as anxiety, so generalized anxiety. But for some people, they develop phobias. So people can become very claustrophobic. And I think the master in COVID have shown that's the case with a lot of people. Can result in panic disorder. So people having panic attacks before exams. Can result in agoraphobia, where people don't want to leave the house and go to placement. And that's something that's not always picked up, even though it should be. And I think that's something that certainly won't be picked up very well during COVID.
Yeah.
And then there's insomnia, sleep problems, eating problems. I think a lot of people who struggle to eat or overeat because of anxiety. So I certainly notice if I'm stressed, I will comfort eat. But if that stress is tipping over the edge into anxiety, suddenly absolutely no appetite and feel sick all the time and can't even look at food, which has its own problems, particularly as I exercise to cope with stress. And then it says here leads to exhaustion and fatigue and feelings of restlessness and urgency. And I can certainly relate to that. The exhaustion and fatigue, where I remember once in third year, like I literally slept for 15 hours, woke up, went back to sleep again because I was just exhausted. And that's because I was bike racing, also slightly malnourished and anemic, and just stressed because I'd just started fourth year.
Yeah.
And then the restlessness and urgency, I think I channel that through sport. Some people channel it through music, but some people can't channel it, and they might just be running around like a headless chicken because they just can't cope. And I mean, sometimes when I'm very stressed, I get lost somewhere that I know really well because I'm just not focused on my external surroundings. I'm just focused on my head going at a million miles an hour.
Yeah, I can totally relate to that.
Yeah, and then burnout, I think, is where it can be caused by stress. I think if you're chronically stressed and anxious for so long, eventually that candle just goes out. And says here that the emotional state is blunted/numb, which has a lot of overlap with depression, where you don't necessarily feel sad, you often don't feel anything. How I describe depression is just this black hole inside your brain, inside the pit of your stomach, that just feels like it cannot be filled again. It says here characterized by disengagement. So I certainly disengaged for bits of medical school where I just felt like I was never going to be good enough. And it either manifests itself in stopping going to placement and putting everything into my cycling, or just being this walking zombie that wasn't taking in a single thing in lectures. Or in final year, I think I was stressed and burnt out at the same time. So I had this ridiculous amount of nervous energy, but I couldn't properly channel it into anything. And then again, yeah, it says chronic form may result in depression and related mood disorders. And I think those related mood disorders can be things that are really severe, to be honest. I think burnout can cause psychotic episodes, can cause mania, can cause really, really bad depression. And I do think when you've got the anxiety and the depression, it's just this constant swinging pendulum, which is exhausting. And then it says, yeah, burnout leads to a lack of purpose and motivation. And I think we're going to see that in doctors of all levels after COVID, where they've had this sense of purpose and this horrible situation where they've had to get stuck in and deal with it. And then post-COVID, I think, and post-lockdown, they've suddenly had to face a lot of demons all at once. And I think a good writer about burnout is Adam Kay. So he wrote This Is Going to Hurt, and I think his coping mechanism for so long was his writing and his dark humour. And then there came a tipping point, and I think he probably swung into complete burnout, where he just felt hopeless, helpless, and lost his motivation to go into work every day. And he gave up and he pursued another dream. But a lot of people who've read his book say it's obvious he wants to come back, but he doesn't know how. And I think I agree with him to some point, but I think if he ever came back, he would need so much support in coming back, and actually it might not be worth it, because I think a career in medicine can be amazing and a lot of people do amazing things, but it's not for everyone, and it's not a decision that should be made at 14 like I did, because I was naive and I was not even a teenager, I was a child. And I think people that have the family pressure on top of it are in a really vulnerable situation with it, where they've been told their whole lives that it's doctor or lawyer or nothing. And then they get through the 5-6 years and there's going to come a point where they realize there's a lot more out there. But equally, it's a really varied career and there probably is something for everyone. It's just the whole getting to the point where you actually have full-on autonomy and choice as to where you work and what field you're working in. That's the hard thing, because honestly, I'm sick of being told that it's going to get better and that I need to be patient, because I've been very patient up to this point, and now I'm feeling restless, and I'm feeling like I'm not feeling burnt out. I'm not feeling entirely stressed, because I've got a lot of other stable things that are keeping me going. But I do think at the end of a 12-hour shift, can I do this again tomorrow? And then more importantly, do I want to do this again tomorrow? And it's not really me wanting to do it or not being able to do it. It's the only thing that gets me to the next 12-hour shift is the guilt of not showing up, which I think is how the rotors cleverly work.
That's how things run.
Yeah.
I think I completely understand what you're saying about the fact that, you know, when we're 15 or 16 and we have to decide whether or not we want to apply to medicine and start that whole process, even though, you know, in our personal statement we write, I understand that medicine is very emotionally demanding. Like, you don't really know. Even if you've done work experience or whatever, I think even now, as 2 months into being a doctor on pediatrics, I probably still don't know and don't understand as much as I will in a few years' time, having worked in the system for a lot longer.
And I had junior doctors on my work experience who had gone into it as postgrads, and some of them had families and things like that, and they said, you should really wait and do postgraduate. But I am certainly the sort of person that can't be told. But to some extent, I did want to have some life experience before medical school, so I chose to defer my entry. I got my one offer and I'd chosen to defer, and I wanted to go and do some exciting stuff abroad, but I actually ended up spending most of my year doing work at home, and I was working as a private carer for kids with disabilities. I was working as kind of a supply teacher but in nurseries, and then I did some tutoring as well, and I find that sort of thing really rewarding, and actually I made quite a lot of money from it. Like realistically, it funded my travels that year.
So bringing it back to burnout, all the things that you mentioned, if someone is kind of listening to that list and they feel that they can identify with some of the things that you said, what would you say would be their next step? What should they do?
I think it's difficult because I think there were a lot of times in med school where I wanted something laid out on a plate in front of me that was simple. And I feel like sometimes it's overwhelming the amount of options there are for support, and it's knowing what works best for you. So there were times where I wanted advice and being told what to do. And there were some times where I wanted someone to just sit and listen and tell me it was going to be okay, or just tell me that it was normal, because it felt so alien, like to have worked so hard for something and then have it make me so miserable. And I think there's still the stigma of, oh, you're so lucky to be here, and if you work hard you'll make money and you'll be happy, and oh, don't worry, it gets better. Like, I think a lot of that can feel very token, because I think there's still a lot of professional boundaries in place where if you go and talk to someone on a hospital ward or even your own GP, there will be the professional boundary of them trying to keep you in the career. So I think it's difficult, and I think everyone experiences burnout differently and for different reasons. I think for me, I actually had an absolutely incredible personal tutor for my last 2 years of medical school. So he's a surgical registrar at Nottingham who is doing research for the GI team there, but he was a Nottingham student about 10 years before me. And the funniest thing was when he gave me his notes to borrow and the learning objectives hadn't changed.
I love that. Yeah.
So, like, a lot of the things with the hypertension guidelines, admittedly a little bit different, but the learning objectives exactly the same.
Exactly
And
the same,
that
yeah.
list of learning objectives for me was just overwhelming, because as a perfectionist I wanted to tick off every single one, but I realized that for me that was not going to be possible when I have the attention span of a goldfish. And I don't engage in lectures either. I remember in first and second year just sat there being like, I was lost 3 slides ago and now they're here, and now,
Oh,
like,
yeah.
and it didn't help that often I was hungover or tired from training. I'd show up to placement with soaking wet hair from a 2-hour swim on a Wednesday morning, and then quite frankly get really hungry around 11 o'clock. So I think it's difficult, but I think if you have a good relationship with your personal tutor, and I think if you don't, then almost prophylactically kick up a fuss and ask for someone else.
Hmm.
And I think there's a lot to be said for mentoring rather than supervision. So I have a lot of positive mentors who are both students, either at the same level or above me, just different sort of students. And then I have people that I look up to as a role model. The CAMS consultant I spent time with on CAMS is very, very supportive, because she understands sport as well. So she understands that for me, sport is not detrimental anymore.
Hmm.
It was at points in medical school where I frankly overdid it, but she gets it. And then, there's friends that I will talk to about certain things. Like, I have friends that are very logical. So if I do want some honest black and white thinking advice, I'll go to them. But then I have other friends, so particularly there's a couple. So one is a vet that I met in second year uni through triathlon, and I just loved going to her house as well. I love the chaos. She's got 3 Labradors, rescue chickens, rescue sheep, and
Wow.
yeah, it's lovely. And her boyfriend's an engineer who we both cycled with as well, and like, she's just a positive role model, but also just a good supportive friend that does understand wanting more to life than just your career,
Yeah.
because she had her own struggles at vet school as well. And then there's my friend from primary school who was world champion sailor when we were in sixth form,
Wow.
and then she had the choice to go onto the Olympic team or to go to university. And she went to university and started rowing, and then she was president of rowing, and then she graduated, did a load of traveling, figured out what she wanted, and now she works actually for AstraZeneca. So she's sort of in health, but she's in health data,
Oh my
and she works
God.
for them in Cambridge. So she's got to where she wanted, and she's actually technically 11 months younger than me. She's just very happy at where she is and very happy with her career and the progression, but also the work-life balance. And I think those are people that I look up to, and those are people that I talk to when I do feel like I want to quit, because they understand the whole not wanting to commit to a career over everything else. whereas some medics and some people that are in academia, or again, the logical thinkers are ones like, come on Laura, just stick with it, like be sensible. And I think part of burnout is that whole wanting to quit, grass is always greener, almost FOMO, fear of missing out, because in med school you get to third year and some of your friends are graduating, and then you get to fourth year and all your friends are graduating, and then they're going for cocktails in London, and some of them are, you know, going skiing, or like I had friends that were going to like half Ironman world champ, and it was the whole, well, this is shit, isn't it? Like I'm stuck at med school all summer and they're already talking about the next set of exams. And I think that was where I was a bit like, oh, why am I doing this again? And I think that's something that I ask myself every day. And I think that if anyone is asking themselves that, I think it can be quite overwhelming to make a decision either way, whether to quit or not. But I think there's nothing wrong with exploring other options. And there's nothing wrong with exploring options within medicine either, and being like, well, why am I hating, say, my surgical placement or my GP placement? Is it because I'm not in a good place mentally? Is it just because it doesn't suit me? And that's okay. And for me, I hated my first surgical placement on general surgery. I was just like, oh my God, like, no. And I avoided going to theatre, and like I didn't like the atmosphere in the wards. And then I distinctly remember when going to take a history from a random patient, and he was an outlier from haematology who had myeloma. Sat down and talked to him for an hour, and obviously it wasn't what I expected, and I don't think I was in the emotional place to talk to someone like that. But I will never forget, kind of, someone with back pain, you need to think of myeloma, particularly if they're middle-aged and otherwise healthy. And then I did a special study module in oncology in my second attempt of fourth year. And I remember there was a patient on the ward who came in with query cord compression, because essentially she just stopped being able to walk and they couldn't find anything. And then talking to her, she'd had a lot of bereavements and a lot to deal with, and it was functional neurological. And because it was oncology and it was all about symptom management and everything, she got a lot of help with getting back on her feet and getting to where she wanted to be. Whereas I think if she didn't have a terminal cancer diagnosis and she came in and was labelled as functional, she would be treated more as an inconvenience on, say, a medical ward or in accident and emergency or somewhere like that, where people have different priorities. This sort of thing is interesting and is important, not just in oncology, but everywhere, the whole of medicine. Like there's a lot of medicine that can't be explained, and there's a lot that you can do. It just takes more time than chucking pain relief at people.
That's a really valuable insight that you came to through that placement that I feel like takes a long time for a lot of people to come to that realization.
Yeah, and I think some people never come to it, because I think it's what I was saying about kind of logical black and white thinkers, where if there's something that can't be explained by a textbook or their own knowledge, they almost switch off from it. And I don't think it's necessarily a lack of compassion or empathy. I think it's just that real struggle with things that can't be explained.
And do you think that that's one of the reasons why mental health within the medical workforce is kind of looked at as, you know, we don't want to understand it because we don't want to think about how it might affect us as well?
Absolutely. Because it's 1 in 4 people, so the chances are, if it's not one of us, it's someone close to us. People carry their baggage in different ways, and I'm often told I hold my heart on my sleeve, and that's something that I frankly have tried to rein in the past, because I'm actually finding the masks easier on that front, in that my facial expressions are less obvious. But I forget that people can still see me rolling my eyes, so I need to work on that one.
I think wearing your heart on your sleeve is a quality that I really admire about you. I wouldn't say that you need to rein it in at all. I think
Thank you.
I'm really, really grateful to you that you were like so open with us today and talking about all of your experiences and your thoughts on this, because like you said, it's something that we don't always talk about as much as we should. I think the stuff that you're doing is amazing, and I just 100% am in awe of you. So before we continue talking for another 2 hours, I feel like we'll draw this to a close. But I just wanted to say thank you so much for talking to me today.
Oh, no worries at all. And I just think another thing that I would just end with is just a few places where people can just go completely anonymous anonymously. So Student Minds is a really helpful website for any student, medical or otherwise, that is struggling. So that's somewhere to look for. And then there's a website called Give Us a Shout, and you don't have to talk to them on the phone. They've got a text messaging support service, which I think will be useful for a lot of people that have a lot of anxiety around phone calls and face-to-face conversations, and they'll be able to listen and signpost.
And one thing I found really useful as well was Nightline.
Yeah, again, they're just run by lovely students that are there to listen.